Hello, this is Dr. Jazz Zairi. I'm a board certified plastic surgeon, and I know there've been a lot of talk about washing your hands for 20 seconds, and I've looked at some of the videos on YouTube, but I think as a surgeon I can add some pearls and some fine details. So let's go to the sink and I'll do a demonstration. I'm going to show you how to wash your hand with soap and water, and also how to sanitize your hands with a hand sanitizer, okay? So let's go to the sink. Okay, so I'm going to show you how to wash your hands first with soap and water. Now I do have, I don't know if you can see this, this is an antibacterial soap, Dial. I don't know who bought it, but, you don't need to use that. You're just paying more for something that you don't need. And the problem with this is that you can get resistance. These bacteria mutate all the time, so you're just going to develop resistant bacteria to this. So the first thing you want to do is, I usually put soap on one hand, and one of the common problems I've seen is not enough soap. So people put a little bit. No, you want to go crazy, okay? Don't be shy. You want to put more than you actually think you need, okay? So a good amount. And then I want to wet my hand, okay? I have a foot pedal here, so I'm going to wet my hand, and then I want to make sure I see suds, okay? A lot of times I've seen people don't use, a lot of water, but you want to see suds, okay? So now the question is, when does your 20 seconds start? Where your 20 seconds should really start once you get this soap on your hand. So really it should be maybe about 25 seconds to be technical. So I'm going to count, and look, I'm going to count now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, so I got everywhere. I got my thumbs. I went in between. You need to go above your wrist too. You want to get this area as well. Most people just stop there, but you want to get your wrist too. Okay, and then if you can, you really, that's how we scrub as surgeons. You want to keep your hand up. The theory is that you want this water, the clean water, to go towards the dirty part of your hand, not the other way around, okay? And I just touched that, I know that. So, but you don't have to be OCD about it. So you want to go this way, okay? So that way the clean water is going to the dirty water, and then hopefully, everything is going down, so you're not touching anything. And then you dry your hands, okay? So you dry your hands. Now, the other thing is, you don't want to go dry here and then go back there, right? Because you've already contaminated. So you just dry the area that you washed, and you can air dry it. Just do that so it air dries, okay? And that way, and then you're done, okay? So that's how. Now, if you had, I have a foot pedal, but obviously you use this to close the faucet, so you don't touch anything. All right, so that's how we do the soap. All right, let's go do the hand sanitizer. Okay, so I'm gonna do the hand sanitizer. I have a Target brand. The main thing is, if you're using alcohol-based, make sure it's 60% at least. This one is actually 70%, so that's pretty good. As far as I know, if you go to any reputable store, and they're all at least 60%. The problem with the alcohol-based sanitizers, or if you're really OCD and you use it all the time, the problem that I've seen is you're going to get cracks in your hands, so your hands get dry, and now you got a problem because you have bacteria and viruses can get through that crack. So if you can find non-alcohol based sanitizers, that's better. You can certainly use lotion, between using these, but now you got to wash the lotion with your soap, because the lotion is going to prevent the hand sanitizer to work. So you see what I'm saying, going back in a circle. So now the second thing with these alcohol-based sanitizers is they don't kill everything. The soap will get rid of everything because it's a way that it binds to the cells, you know, breaks the cell wall, and then everything gets washed off. For example, there's a bacteria, Clostridium difficile, and patients who are on antibiotics sometimes get it. So if you're on antibiotics and you get diarrhea, but your stomach is really swollen, like you have constipation and you're not doing well, you need to see a doctor. And if they get an X-ray of your abdomen, it's full of gas, but you have diarrhea. So it kind of doesn't make sense, the X-ray finding with the clinical finding. And that bacteria have spores, so it has a thick wall around it, and these alcohol-based sanitizers do not work. The same thing with fungus. You know, funguses have spores and these don't work. Now, thankfully, in the normal population, fungal infection is, I would say, non-existent. I mean, you really have to be immunocompromised or really sick or just something really weird happened that you get a fungal infection. But if you are immunocompromised, you should not use alcohol-based. I would recommend soap and water. Now, the common problem that I've seen is not that people don't use a lot, so just do that. I recommend doing even more. Okay, so put more. You really want it wet. So I don't know if you can see my hand, how it's glistening. I don't know if it'll show, but it's glistening. And again, I want to go towards my wrist. Okay. Okay, and I keep doing that until it's dried up. Okay, so you got to keep doing that until it's dry. You see, so it actually takes a lot longer than you would think. Okay, so then you can air dry it. Now, these hand sanitizers also don't work very well. See, my hand was a little bit wet from the soap. So if your hands are wet, obviously it'll dilute the concentration of the sanitizer. If your hands are wet or sweaty, obviously if you have dirt on your hands or even dust, let's say you pick something from the garage and it's dusty, you should wash your hands with soap and water because you're just distributing this dust with the alcohol in there. So that's how you want to do it. Put a lot in there so it's really wet and it's glistening, and you want to do that, keep going everywhere until your hands are dry, and then you're good to go. All right, so I hope this was helpful, and if you have any comments, please post below. I appreciate it. Thank you. Bye-bye.